Warn that anyone who's about to have surgery needs to tell their doctor if they use marijuana. Sabrina Wilson explains why not coming clean could have devastating results in her special report, Undisclosed.
Cannabis, it sprouts naturally in some parts of the world, and marijuana comes from it.
The thing about marijuana, it's fat soluble, so it stays around your body for a reasonable period of time.
The federal government classifies marijuana as an illegal drug, but a growing number of people use it recreationally. According to the National Survey on Drug Use and Health, cannabis was one of the most used drugs in the U.S. In 2021, it says over 35% of young adults 18 to 25 years old reported using marijuana in the past year. But age aside, marijuana use is something to be upfront about, especially before undergoing a medical procedure. Dr. Richard Pino is a professor and head of the anesthesiology department at LSU Health, New Orleans.
The effect of marijuana can be significant on an anesthetic, depending upon the procedure and depending upon the anesthetic.
A growing number of states have legalized recreational marijuana use.
Cannabis is becoming increasingly legalized, and people think it's relatively harmless, so there's very little information, especially during surgery, how it affects people.
So Dr. Paul Potnuru, an anesthesiologist at UT Health Houston, conducted research.
And so we looked at trying to figure out exactly what kind of complications it's causing after surgery, and to see how big this effect was in cannabis users.
Potnuru is first author of the study that made headlines. It was published in the journal JAMA Surgery and looked at cannabis use disorder and perioperative complications. Perioperative refers to around the time of surgery.
So specifically, we looked at cannabis use disorder, which, as you mentioned, is a form of using too much cannabis or overuse cannabis.
This study analyzed over 12,000 raw hospitalization records around the U.S. after major surgeries from 2016 to 2019, and researchers say in reality that represents over 62,000 hospitalizations.
And the complications we looked at were what we call major complications after surgery. So things like heart attacks, strokes, kidney injury, blood clots, infection.
The findings demand attention. The research shows regular cannabis use is associated with an increased risk of morbidity and death after major surgery.
We compared patients across the United States that are heavy cannabis users versus patients that are not cannabis users. And we found about a 20% increase in these major complications in people who use cannabis heavily.
The impacts of marijuana use go beyond that. Users may need additional anesthesia.
When we give an anesthetic, for instance, we are modifying the nervous system. And these drugs modify the nervous system even more. So for many patients, their metabolism is a little bit higher, and they can become resistant to some of the effects of the anesthetic.
We know that patients who use cannabis regularly need more anesthetic medications to go under. We know that they have increased risk of nausea and vomiting after surgery, and they have increased pain after surgery.
And having to give a patient more anesthesia could affect recovery time.
Recovery might be a little bit longer.
Even without a medical procedure, they say marijuana affects the body in worrisome ways.
What is significant is that many patients may, with chronic use of marijuana, have cardiac disease and may have a risk of increase in myocardial heart attack.
We know that cannabis can suppress your immune system, and that's probably what leads to the higher infection rate that we found.
Complicating things further is that marijuana potency varies.
That's one of the big challenges with quantifying cannabis use. So there's a study showing that the potency of cannabis just between the early 90s and now has steadily increased every year. And if you're ingesting cannabis, for example, through edibles, the THC content, or the active component of these, can be very high.
So bottom line, don't hold back. Come clean with your physician, anesthesiologist, medical professionals if you are a user of marijuana.
Yes.
Even if it's medicinal marijuana, which doctors prescribe.
Anesthesia is actually very safe. We have monitors that we tell us what the physiologic status of the patient is.
But it's critical that marijuana use doesn't go undisclosed. I'm Sabrina Wilson, Fox 8 Local First.